Good evening, everyone. Welcome to the Parkland Institute's launch of our new report, Time to Care, Staffing and Workload in Alberta's Long-Term Care Facilities. My name is Bill Kilgannon. I'm the Executive Director of the Parkland Institute, and we are very pleased this evening to be hosting with CUPE Alberta and the Alberta Union of Provincial Employees. Before we begin this evening, in recognizing that we are speaking to you today from the City of Edmonton, I'd like to acknowledge that we are on Treaty 6 territory, of which the city and all its citizens have enjoyed the benefits of treaty. We acknowledge and honor all our ancestors, traditions, and spirits of this gathering place that first drew Indigenous peoples, the Cree, Nakota, Dene, Blackfoot, Métis, and then settlers to this special place. We're just getting people to sign in now. We're very excited to have 200 people registered for the evening, and we have an excellent lineup this evening. We will start this evening with a presentation, of course, from our report author, Rebekah McCrae. This will be followed by talks from two frontline healthcare workers who work in long-term care facilities in Alberta. Kelly Spence is with CUPE Alberta, and June St. Louis is a longtime member of AUPE. So both will be speaking after Rebekah's presentation. We're also pleased to have Rory Gill, President of CUPE Alberta, and Mike Dempsey, the Vice President of AUP, joining us this evening to each speak following the talk from June and Kelly. We will then open it up to questions from you, and we hope to have everything, or will have everything all wrapped up this evening by 8:30. So in the chat feature, I'm sure most of you are getting used to these Zoom presentations. You can open the chat on the side. We'll be adding a few links here and there. Very shortly, we'll add up the link to the actual report on the Parkland Institute website. And we're very happy if people are interested in chatting, adding your comments, etc. We just ask for everyone to make sure that it's respectful going forward. After the presentations, we will be opening up for questions and answers, but we'll do that with 200 people via the Q&A function. Again, for those of you who may be new to you, I'm sure most of you are used to this, but if you hover your mouse over top of the Zoom images there, you will see the Q&A feature in the bottom part of your screen. And so you are able to do that. As well, if you're new to Zoom, you can also switch your settings to speaker view so that you're able to see Rebekah's PowerPoint presentation as we go forward. So without further ado, I would like to introduce Rebekah McCrae. Rebekah is a co-worker of mine, a research manager at the Parkland Institute. She completed her undergraduate and doctoral studies at the at Queen's University Belfast. She did her PhD in Irish politics, completing that in 2006. She previously worked with the Quality Commission for Northern Ireland and worked at Edmonton City Council here before joining the Parkland Institute a number of years ago. Her research at Parkland Institute focuses on health and social policy issues, including basic income, healthcare privatization, and working conditions in long-term care. So with that, over to you, Rebekah.
Thanks very much, Bill, and thanks everyone for being here. I'm gonna fiddle with the screen share here for a second, and then I'll get into the nitty-gritty. Okay. I always overshoot, sorry. I'm really proud and humbled to be the named author on this report, Time to Care, Staffing and Workload in Alberta's Long-Term Care Facilities. I would first like to acknowledge that I took over this project from my predecessor, Alison McIntosh, who unfortunately can't be with us here today, who did a wonderful job behind the scenes putting the research together while I was on maternity leave. And so at least 50% of the effort, and maybe more, goes, the credit should go to Allison for that. So, so I guess to give a little bit of a lead into this, at the moment, I know that long-term care is finally getting a little bit more attention, and unfortunately it's getting attention because of overwhelming tragedy and unnecessary tragedy that we've been seeing across the country and also here in Alberta. And I think I'd like to touch on that it's kind of become a very, almost a cliche to say, oh, the pandemic has shone a light on the issues in long-term care, which, while I'm grateful that we're getting coverage for that there's new attention being paid to this within the media and within perhaps political circles, that's not entirely accurate. Those issues have been known and very loudly raised by so many people with an interest and a personal stake in long-term care, from the frontline workers and their union representatives to scholars and research experts in the area, and as well as families of long-term care residents. So when we started thinking about this research, we didn't understand that there was a pandemic on the horizon. I mean, I don't think any of us anticipated that. But we knew that there was already a crisis in long-term care. We were hearing it from so many people who were living that. And so the objective of this research was really to see if we could confirm those sort of alarms that were being raised, those warnings that we were hearing, by talking directly through a survey to long-term care workers. So with the collaboration of CUPE Alberta, we developed and distributed a survey, both an online version and a paper copy, which CUPE Alberta distributed then through their locals to their members working in long-term care. And between November 2019 and March 2020, we received 370 responses from CUPE Alberta members. Our respondents covered over 12 job categories. We weren't just looking at direct care roles, but that was the majority of respondents. Healthcare aides and recreational and occupational therapy assistants were our second most numerous category of respondents. We also had surveys come in from dietary aides, cooks, maintenance, housekeeping, as well as LPNs. So they're very much trying to get a very full picture of long-term care and to recognize that the work in all of those roles is essential to that care environment. And the biggest thing that we heard from our respondents was about time and more specifically, the lack of time. It was actually some of the more difficult responses to read and codify as a researcher because they are quite emotional. We asked, as an open-ended question, we asked workers what would they do if they had more time in their working day. And the responses to the last one all spoke about wanting more time to provide the level of physical, emotional, and social care that they felt their residents needed and deserved, and that they were not able to provide. And we also found that workers didn't have time to adequately care for themselves, to take sick time, to take vacation, to even take their mandated breaks in the middle of a shift. So these things all add up to a serious impact on residents and on frontline workers. So one of the ways that we tried to quantify a bit how much time workers didn't have, pinning down a lack of something, we asked, how often do you have necessary tasks left undone at the end of a shift? And so this could be care tasks. This was often cleaning, and in particular deep cleaning. This could have been things like updating patient resident charts, pardon me, or other necessary paperwork. So this isn't the luxury stuff. These are basic tasks that are intrinsic to these roles. 75% of workers told us they didn't have time to do all of their necessary tasks within the space of their shift, which I think is astonishing. So less than 1/4 replied that they never had to worry about that they never had tasks left undone. But it's increasingly common for workers to have something that they weren't able to fit in. And in some of the open answer responses that we received, workers talked about this with just a sense of being overwhelmed almost. I never have more time. I'm always overloaded with work. There's so many things to do. We're always rushing to finish. And respondents spoke about this task focus, like they have a checklist that they're just rushing through, and that doesn't leave a lot of space to focus in a personal way on their residents. Oh, sorry, I've gone ahead again. So what this unfortunately leaves workers in a really difficult position where they have to choose whether to leave those important tasks undone, hoping that the next shift can pick them up and somehow squeeze them in their own very loaded schedules, or what we found from most of our respondents was to choose to stay late past the end of their shift in order to get all of those things done. We found 70% of the workers who responded to the survey had to stay late. And amongst that, 25% stayed late either every day or at least once a week. And around that, we also found that workers were having difficulty taking their breaks. They were working through their breaks to try to avoid having to stay on late or to leave those tasks undone, which, as so many of our respondents mentioned, made their shifts very stressful and tiring, and contributed to a sense of burnout and exhaustion. We also found that for quite a number of these workers, they were not being compensated for that additional time at the end of their shift. If it's not categorized as official overtime, then those 15 minutes here and there certainly add up in your day, but they didn't add up on a paycheck. So this is essentially free labor that workers are providing in order to ensure that their residents are not left in the lurch. And I think the statistic that, for me, just was really difficult to process when we asked how often workers found their facilities understaffed. 90% reported that they worked understaffed at least occasionally. Only 1 in 10 of our respondents said that they had their facility never worked short-staffed, which is quite an overwhelming statistic, I think. And what we know now is that the pandemic conditions have completely blown that out of the water, with staff isolating due to exposure or illness and other factors coming in, particularly as well with the single site rule exacerbating that, as well as workers who have additional caring responsibilities within their own families, caring for their own elderly loved ones at home or caring for children. 1/3 of our respondents had additional caring responsibilities within their families that they would have had to somehow navigate within this difficult time as well. We also found in particular that ownership, mode of delivery, and profit status were significant in how these numbers stacked up. So really, a question at the heart of our research objective was to ask staff whether their facility had an adequate staff to resident ratio in order to provide quality care. And across the board of our respondents, 41% said seldom or never, which is telling in and of itself. However, breaking that down by the profit status of the facilities in which they worked, it was quite striking that for-profit facilities, staff replied, 34% replied that their facility never had adequate staff to resident ratios to provide adequate care, which is a huge contrast when you look at the response for those working in public facilities. Only 7% felt that their facilities ratio was never adequate. And the flip side of that, in public facilities, workers felt that it was always or often adequate over 57% of the time, compared to the private facilities. So amongst nonprofit homes, that number was right in the middle, actually. So I'm sorry. I just sometimes find that really overwhelming. So I will skip on ahead for a minute. Before I talk a little bit about the recommendations, we can talk a little bit about what those numbers mean in terms of the impacts for residents and for workers. In particular, we asked our respondents what they felt were the consequences that they had seen in their experience of understaffing regarding resident care. So overwhelmingly, our respondents answered this meant a delayed answering of call lights for whatever requests or needs that a resident might have, a delayed turning of residents that might lead to pressure ulcers or bed sores, an increased risk of resident injury. Several of our respondents noted they wished they had more time in their day so they could watch the fallers, or the ones who are most likely to slip or have an accident in that sense. It also very frequently meant delayed assistance with getting to the toilet, or delayed assistance with feeding and meals. It meant that things like bathing or taking residents for walks were cut short or done in a minimal kind of manner. And it also meant that residents themselves were experiencing increased agitation, and sometimes leading to more aggressive behaviors amongst residents when they themselves feel rushed, when their staff is constantly changing the people who are providing that very personal level of care. So a significant number of our respondents spoke about their experience of verbal aggression from residents. Find the number. 82% of our respondents had been verbally abused by residents. 57% had experienced physical aggression from residents, and 37% had experienced sexual harassment from residents. A further 19% had witnessed violence directed at residents from another resident. So the research tells us that those behaviors are much more likely to occur when residents feel disrupted, when they feel they're not given adequate personal time, and that their emotional and social needs aren't being met. And these conditions clearly, put frontline workers in a great deal of emotional and physical stress. Amongst our respondents, 53% had experienced burnout or symptoms of post-traumatic stress or mental stress. 30% had experienced illness or injury on the job, but very, very few of them had taken a stress leave, and very few had ever reported these incidents of abuse or violence or difficulties that they had experienced. We asked an open-ended question, how many of these incidents have you formally reported? And I just was sort of astonished, the number of responses that were like, I tried once and I was ignored, or I don't report these things. It's part of the job. We're expected to handle this. Which was, I think, very, very difficult for someone not in this line of work to really process. So what we know from the pandemic context is that mental and physical stress has quadrupled or multiplied a dozen times. And studies are now currently looking at the impacts of PTSD on frontline long-term care workers due to the pandemic. And I wonder that baseline for emotional stress appears to have already been quite high. Meanwhile, we asked our respondents about the connection between these violent incidences and the staffing levels within their own facility. 43% of our respondents felt that at least one of those incidents occurred when their facility was understaffed. And when we asked those participants, would additional staff help to prevent incidences of violence and injury, as 65% were adamant that additional staffing would help prevent that. So the really difficult thing to try to understand as a researcher was how to differentiate between our very real need to provide numbers and provide some kind of basis for policymakers to say, look, this is the scale of the problem here, and we need to find solutions to this. But what we heard the most through the research that we undertook was the really deep sense of duty and of care amongst frontline workers, their deep desire to want to provide care, to care for and care with their residents, and understanding then that care is supposed to be a relationship. And too often the conditions in which they were working, even prior to the pandemic, didn't allow for that to be the norm of their day. Care instead became a list of tasks to complete that you just didn't even have time to complete. So I really wanted to be able to convey that a little, but I know that our speakers will have a much more direct sense of that. I've gone back again. So to talk a little bit quickly about some of the solutions we've proposed, these are actually not my, these aren't my suggestions. These have been called for from policy researchers, gerontologists, seniors care experts, advocates, families. They're very, very obvious solutions that need to happen in the immediate sense and in the long term to address these things. And absolutely, first and foremost, has to be an increase to staffing levels that's tied to federal funding that is enveloped in the proposed national standards and that are enforceable and actually are enforced. not left up to, each facility to submit their numbers as they see fit. Within that is also the working conditions for long-term care staff need to be made more equitable. They need to be provided with benefits, and in particular, paid sick leave, mental health supports for direct care staff are more important, obviously, in the wake of this pandemic, but clearly they've always been needed. And also that long-term care providers need to ensure at a minimum that there are adequate staff on shift to allow for every worker to take their mandated breaks. And finally, there needs to be a shift in our thinking, and I learned this very much from Pat Armstrong and others who've been asking for this for a very long time, to actually empower direct care staff to have more input into resident care. Healthcare aides, for example, provide anywhere from 75 to 90% of direct care for residents in a day. Recreational and occupational therapists work with their residents, on a personal basis. They know them, they understand them, and they should have a big part to play in the care that's provided. And Alberta Health should also replace this activity-based funding, the task checklist and the metrics, with a deeply ingrained sense of relational care. Care is caring. And a huge part of that, the way to underpin all of that, is to remove the profit motive from care, and to be able to fully fund adequate direct care hours for every resident. So finally, to say that in order to build that resilient long-term care workforce, to provide the best care, not just minimal care, to include all workers as essential, to understand that all workers within long-term care contribute to that care environment for the residents, and to fund that and to consider it as valuable. Those are political obstacles, and that's the hill we have to climb now. So thank you, and I will turn this over to our frontline workers. Thank you.
Thank you so much, Rebekah. That was great. I know how incredibly hard you've worked on this report and done an amazing job. So I really appreciate that. As we said earlier, we're going to hear from two frontline care workers, and I would first like to call upon Kelly Spence, who has been working at long-term care for many years. She can tell the details on that and is a proud member of QP Alberta. Over to you, Kelly.
Thank you so much. Good evening, everyone. My name is Kelly, and I am a site vice president for QP Local 8. I have worked in healthcare for 20 years, 14 in long-term care. I worked as a nursing assistant for 12 years before becoming a recreation therapy assistant. I have worked in assisted living, home care, and adult day support program, not-for-profit and for-profit settings. Anyone who works in this environment does it out of love. We do it for the many beautiful moments we experience through the day, a smile, a hug, holding someone's hand to make them feel safe. Every day is a new day, and you never know what's going to happen. I work on a dementia unit. Its challenges range from meeting people's regular daily needs, as well as providing a stimulating, comforting, home-like environment for them to spend the rest of their days. Every individual has different needs. Some need total care, some need medication, and many need emotional support. When the lives and happiness of others are at stake, your work isn't always finished when the clock hits 4 p.m. We have to be there for the residents when they need us. Some days are hard, most days lately. Staff are tired, they are exhausted, and they need 6 hands when there are only 2. Starting your shift early to get a jump start on your day, working through your breaks, or staying late past your shift to complete tasks is not uncommon. The saddest part of my job is the reality that we do not have enough time to spend with each resident. The people we care for and love every day are someone's mother, father, grandparents, sister, brother, or friend. These are human beings that deserve the best level of care. Every company I have worked for has followed government guidelines regarding how many staff to residents is required, but these ratios are not adequate with what is needed, not by a long shot. Throughout this pandemic, many staff have expressed the hope that the world now understands that we need to support our elders and vulnerable family members living in long-term care. Our facilities need government support to hire more staff. We need to increase the minimum care hours required for all facilities. Increasing these mandatory care hours would reduce the workload on employees and would improve the quality of life for residents. Exhausted, rushed, and stressed staff cannot provide the level of personal relational care that residents need and deserve. We love what we do, but we are tired, and the government needs to step up and do something about it. Thank you.
Thank you so much. That is very powerful to hear just how dedicated you are and how challenging it is on a day-to-day basis with everything you're experiencing and your coworkers are experiencing out there. So we appreciate you being able to share that experience with us tonight. So I would now like to introduce June St. Louis. She's another long-term care healthcare worker and is a proud member of AUPE. Over to you, June.
Well, thank you. My name is June St. Louis, and good evening. Thank you for this opportunity again to share my opinion, and I'll generalize it. It's been really tough. With over 25 years of service in long-term care, I've seen the decline in resident care. Staff shortage has always been a problem and became increasingly worse over the years. It's very unfortunate that the government does not care about workers nor elderly who built this province. We are called heroes, however, we don't feel like we are treated as one. We feel unappreciated, disrespected, and undervalued. It is a fact that with fewer staff, workers have less time to do good care. Families put their loved ones in care, hoping they would be cared for in the best way possible. Most long-term care has bare minimum staff. That means if there are sick calls, it creates problems for workers and residents the same. Your workloads are increased because you have to pick up extra duties. So whatever that person that we're supposed to be doing, you have to do yours, including theirs. So so you have to do two people's job instead of one. The standard nurse to patient ratio is irrelevant, especially at this time due to the COVID pandemic. The nursing staff continuous wearing of PPE increases the amount of time spent providing care. Management should not use low capacity as a yardstick to measure short staffing, like making statement like this. We have 3 empty beds, so we don't need to replace 6 staff. We can do it. Short staffing level leads to unreasonable workload, which can also impact the quality of care for residents. Staff nursings are both resident care and the success of the nursing staff. No time for quality care because more focus is done and completing the task instead of personal care for residents. No time to listen to them. Our residents like to share their stories. They like to talk. They like to tell us everything, but we have no time to listen because our focus is on getting to the other client, to answer the call bell, to do repositioning, to feed. So we don't have time to listen. Not that we would love to listen, but there's no time to listen. With fewer staff, we have to make also decisions. What can we leave behind? What can be done? All aspects of care are important. So the decision not to get something done is usually difficult for workers. Instead, they would stay behind after work, miss their breaks, and shorten their breaks so they can get it done. Okay, leave it for next shift. Next shift is also short, so they won't be able to get that work done as well. Let's take shower, for instance. In long-term care, a resident gets 2 showers per week. So most of the time, you decided, okay, we'll leave the shower for another day or another shift. Another shift is short, showers don't get done. Another day, yeah, you're short again, that's not get done again. So that person only received 1 shower that whole entire week. And sometimes that keep repeating itself over and over and over. I'm a local chair. I heard many stories from different facilities. And I spoke about, a staff told me that in a long-term care, which is private for profit, they had 30 residents, 2 staff, 25 were total care. Total care meaning you do all aspects of care. That person cannot move, can't transfer, can't feed. They have to be washed, dressed, making sure they have their hearing aid, dentures, glasses, and sometimes they need to be toileted if they're not incontinent. So you have to hook them up to a mechanical lift, which requires 2 staff. Transfer them to the commode, because you have to pull them in, put them on the toilet. When they finish, you gotta transfer them back to bed because they cannot stand. Change up, provide, put them back in wheelchair, take them to the dining room, and that only gave you an hour to complete all that 30 clients. Think about it. And you have to do that 25 times. And then you have to feed. After you finish feeding, you take them back to the room, toilet them again. Okay, you toilet before and after meals, change them, put them in a wheelchair. The call bells are ringing, other clients are calling out, and you feel you don't know what to do. You just sit there, you feel worthless. You feel that, is this why I'm a nurse? Is this why I gave up my life? Is this what I would want from myself? Is this what it's all about? And you hear, well, you can do it. This is all the staff that I have. We don't have the funding. Those are what you hear. But the clients cannot respond to that. Regular staff are burnt out. They don't want to pick up anymore. Workload increased during the pandemic due to workers getting sick and had to be isolated. This pandemic caused more work for us, for all care. Because if our clients say we have 25 beds and everyone is isolated, we have to go and change our PPE for every single room. Every room you enter, you have to go enter, change. And then you have to bring trays to every single room. So that increased with the same amount of staff. The same amount of staff doing extra work. Staff shortage can also harm residents. With inadequate staffing leads to inadequate care, which leads to increased UTI. due to lack of pericare, lack of fluids, skin breakdown, no time to do reposition or resident care. Resident will sit in incontinent product for hours and you're not able to change them for a length of time. We increase in falls. Okay, you don't have time to monitor clients who are high risk for falling because it's only 2 staff or maybe 3 staff. So they get injury. We sometimes think about clients maybe have choking risk because you're rushing through to do the feeding. Maybe the consistency is not right, but you're so tired, you don't even sometimes focus. You're so tired yourself, so you don't have time to focus. And you're short-staffed. You're thinking, what's next? That's your task. What's next? Did I check this off? Like Rebekah said, yes, it's a checklist. You check off to see what has been done and what you don't need to do. So that's very, very increased behavior for call bell because clients don't feel that you're answering the call bell promptly. So they have a lack of trust for you. They don't trust you. They go into depression. They're withdrawn. They're lonely. They lack personhood. They're socially isolated, especially with this pandemic, because clients, they stay in their room with no stimulation, no family, sometimes no touching. You enter the room in your PPEs and your gloves and everything. Sometimes I'm wondering if they are scared. Who is coming in my room? They can't even tell who the person is that coming in the room. If you were sitting in a room, say for instance, you're lying in a bed, you can't move, you can't talk, you can't do anything. Somebody walked in your room. Sometimes some of them have dementia, so they don't really know. Somebody walk in your room dressed in covering their face, and you think they're coming to kill you or rob you. So these are the things that our client has to face. Yes, if we had more staff, we could do more. We could have the time to sit and talk with them, explain to them what's going on. Because some of them don't remember, you say 1 second, they forget. But you don't have any time to repeat because you have to go on to the next person. Staff shortage is an unreasonable expectation placed upon nursing staff that leads to staff experiencing a phenomenon known as burnt out. And that increases sick calls, which further exacerbate staff working and increase workload. Staff are mentally and physically exhausted. They do not have time to take breaks. They have to be working excessive overtime. They sometimes say past their shift to get duties completed. We go into nursing because we care. Most of us don't go into nursing because we want to find a job. Our big one we want to find it because healthcare aid don't pay much. So it's not for the money. We go in there because we want to make a difference. We want to take care of people. We want to make sure that one day when we get there, this system that was created by whom, I'm not sure, 1.9 hours, will be different and we'll be able to get care. Kelly says she told her family she don't want to be in a nursing home. I told my family that as well. It's very sad because I spent over 25 years in long-term care and I don't want to be there. I would prefer stay on the side of a beach and somebody fan me to death than staying in a nursing home. That's how much I feel about long-term care. Yes, it pays the bill. Yes, it put roof over my head and clothes on my back. But it's really sad that our elderly are treated in such a manner. It's very, very, very depressing. And I don't like that. We get abused. Yes, family abuse us, resident abuse us, and sometimes even our coworkers abuse us. Because, yeah, and yes, we're told, yeah, it's part of the job. And we continue, and we go back to work the following day, and we do it over again. We return home exhausted, fatigued, irritable, stressed. We have family issues, relationship issues, and co-workers issues. Sometimes we're told that we're to be blamed because we lack organizational skills. You're not organized. But how the heck do you organize more than what humanly possible? You cannot. I consider myself to be a very organized person. I pride myself in it, but I only can organize thus far. So I don't take that lightly. Having more staff can be cost effective for long-term care facility. It reduces medication errors, shorten or reduces admission to hospital for residents, improve overall well-being of residents in long-term care facility, and help save in medical costs. New hires must complement the company culture and integrate themselves seamlessly into workplace. Transparency, maintain a fully updated rest time schedule that staff can access 24/7 and plan their lives around accuracy. Managers should provide a retaining pathway that is supportive to new hires to enable them to stay and be part of a team. Managers should encourage filing sick calls promptly instead of focusing on budget. Managers should encourage vacation time off and approve vacation requests to improve burnout and the overall morale of staff. Doing this would improve the amount of sick calls that leads to temporary short staffing and increased workload. For me, it's stressful, uncertain, not sure how long this COVID gonna last or this pandemic gonna last. Lack of family time, lack of social time. But I look forward every day to getting into my facility to sing a song to my resident, to hold their hands and said, I love you. I'll be here for you. I care about you. Just recently, I had a client was dying, and I sat by his bedside. The families came in, and they said to me, could you sing for him? There's a well-known song for him. It is well. And I say, yes. And I sang that well-known song for him. And I held his hand and I pray with him. And he says to me, June, please do not let me have pain. Thank you very much for all that you have done. Thank you for singing to me. Thank you for standing up for me. You see, this is the reason why I do what I do. Because you know, whatever you sow, you shall reap. I want to make sure that I sow good seeds, that one day when I come to this place, I'll be well taken care of. And somebody will sing me a song. Somebody will hold my hand. And somebody will pray for me and tell me I'm going to be okay. This is what I would like to see happen in long-term care. I'm almost ready to go out the door, but I'm open and praying that before I leave, I can see some changes. It's been over 25 years, and I don't see the change. Thank you very much for listening to me.
Thank you so much, June. That's so incredibly powerful. So next I'd like to invite Rory, President of QP Alberta, to say a few words. Thank you.
Thank you, Bill. And first of all, I want to thank June and Kelly for sharing their experience with us. And it's truly gut wrenching, to hear what they face on a day-to-day basis. And I just simply can't thank them enough for taking time out after a long day, and thinking about what they face every day, but to share with us what they face in long-term care. And I also want to thank Rebekah and Alison McIntosh and everyone at the Parkland Institute for the work that they did. There's some questions I see in the chat about funding and things like that. And if you look at the agenda, what I'm to talk about is what unions are doing, and I will talk a little bit about that. But I want to talk a little bit about how we got here. And initially with the report that we worked with Parkland on it in 2019, and that was of course before the pandemic. We knew, because we talked to our members as constantly about these issues, that there was a crisis and an impending catastrophe in long-term care, and it had been building and building and building for years. And if you think back to the 1990s, when there was what I believe was a completely manufactured public sector debt crisis, and we're living beyond our means and that sort of nonsense. And of course, here in Alberta, we were blowing up hospitals and doing other things in the healthcare sector. We were told that long-term care was unsustainable, and we had to bring in private providers, let the market decide, and the market would bring in this magical efficiencies, and we'd be able to care for people, and we would see these incredible outcomes. And it was total and utter nonsense, along with every other privatization scheme I've seen during my lifetime, but absolutely tragic in long-term care. And both June and Kelly have experience in the public and the private side of things, and they can both, when we get to the question and answer, I think they can give you an idea of, even in the terrible situation we're in, if you compare the public facilities to private ones, there are definite different outcomes there. But when we talk about private providers and for-profit providers, I think it's really important to keep in mind that they are extracting profit as we speak right now. There are companies, national companies, that are providing dividends to shareholders in the millions of dollars. And these are companies that have taken federal subsidies, during the pandemic, have taken provincial subsidies the same. And again, right here in Alberta, when we talk about private providers, there is a bill in the legislature to shield providers from the consequences of their negligence, of their inability to properly resource their staff, to help their staff, and shield them from lawsuits, coming out of the pandemic. And I'd also remind folks, today in Ontario, we found out that in Ontario, last year when the Canadian Forces had to go into some facilities to assist with the residents there, and they found just tragic and shocking conditions of residents, and residents passing away, not because of COVID, not because of their underlying health conditions, but because nobody was there to give them water. And we found this out. The Ontario government said, yeah, we'll deal with this. And that was an out and out lie as well. And I can tell you here in Alberta, at the beginning of the pandemic, our union, AUP, and other unions set up talks with the government. We said, we know there's a horrible crisis. We know it's going to be exacerbated horribly by COVID-19. We need to figure out staffing levels. We need to figure out, how to properly pay people and make up for the deficiencies right across the system. The government I wouldn't even call it lip service. Our union, and Mike can speak to this in AUP, but we work together with other public sector unions to try to get the government to accept this. They did nothing. They dragged their feet on a single site mandate, which I believe contributed to the deaths and illnesses of hundreds of people across this province. And they didn't do anything with the federal government money that was provided, to help frontline workers, specifically in long-term care. They were parsimonious to an incredible degree, and they did nothing throughout last year. So we are in a situation now where, as June and Kelly have so eloquently put us, that we're just barely hanging on. And so what are we going to do about it? Our union, AUP, have been talking about this for a generation now. And I can say as a leader within my union, I know I wasn't doing enough before the pandemic. We knew what the situation was. We were partnering with people, but we just weren't bringing it forward. So we are doing whatever we can. And I guess the question would be, well, are you talking to the government? And I have to tell you that Jason Kenney's UCP government is more likely to talk to the devil than to a union leader. And some of you probably think they already are talking to the devil. But we are doing our very best, you know, to get those conversations going. But it is, they couldn't, and you'll have to forgive me, they couldn't give less of a shit about what is happening right now across the healthcare system, and particularly in long-term care. So we are doing whatever we can to connect with people and get them to talk directly to their representatives, you know, both federally and provincially. I'm going to put a couple of website addresses in the chat when I'm finished, and people can quite rightly ask, okay, so you've got websites, so what? First and foremost, we can get messages to our representatives. And the other part is, and I'll be quite frank about this, if you sign up for these websites and you send an email, we've got your email address if you want to give it to us. And I hope you do, because it is our sincere hope in CUPE, and I'm sure AUP is working on very similar things, that once we get through the pandemic, and I believe we will, it seems to be taking forever. And again, this government here in Alberta is doing everything they seemingly can to make it last longer. But once we get through there, we want to start talking to people. We want to start meeting with people. We want to start marching. We want to start rallying. We want to start getting the message out that long-term care is in crisis. It's been in crisis for decades, and it simply can't go on. And I'd also point out, and I think we're all aware of this, there are literally millions of people who are going to need this care. You know, the baby boom generation, the majority of them are now over 65. You know, I'm a Gen Xer, but I'm, you know, on my way there as well. And June and Kelly quite eloquently pointed out earlier today, and so did Mike Dempsey, that everyone very likely is going to need some sort of continuing care when they become elderly. And we have to face up to this. This is, you know, for our relatives and for ourselves and for the children who are going to be taking care of us. We need to have decent facilities. And it's just heart-wrenching when I hear Kelly and June talk about, like, they have told their kids, don't put me in long-term care. And they've dedicated their lives to it. And I'll tell you, you know, the work I do, when it comes to long-term care, you either last a few weeks or you're there for your entire career. And it's a calling. You can tell by listening to these two women that they've dedicated their lives to it. And that's how we've managed to get to this place without this catastrophe that I've talked about. But they're tired and they need some help. And, you know, you can look at them and you say, well, they're so full of energy, but, you know, everybody at some point needs some respite. Everybody needs some help. So that's what we're here to do. I'm so glad you're all here tonight. Like I say, we'll have those, you know, I'll put those website addresses that we're doing. I'm sure Mike's got stuff to talk about as well. But I promise you, once we get through the pandemic and we can safely meet, we will make ourselves heard. We will make the governments at the federal level, the provincial level, understand that long-term care has to be fixed. And I saw somebody say, well, where do we get the money for this? First and foremost, you know, every long-term care facility in this country has to be public. It has to be part of the public healthcare system. You know, where are we going to get the money? Well, here in Alberta, we can start by taxing the wealthiest corporations in the world, stop giving them tax breaks. We can make it part of the public healthcare system. We can dedicate ourselves to caring for people. And as I say, I mean, you know, if we can find money for billionaires and billionaire, you know, and oil companies that are profitable to the likes of which you've never seen in human history, we can find enough money to make sure that our elderly, infirm, and vulnerable are taken care of, and we can help Kelly and we can help Jane. So that's what I have to say. And I thank them so much for everything. I thank you all so much for being here tonight. So it's great to see all of you. Thank you for your time.
Thank you, Rory. I love your passion. I love your leadership on all of this. And thank you so much for the support you've given for Parkland and for this report and being here tonight. So Mike Dempsey is next. Mike is the Vice President of the Alberta Union of Provincial Employees, AUP, and the chair of their Political Action Committee. So call on you, Mike, to say a few words, and then we will open it up for people who are posing questions in the chat right after. So if you've got some questions, you can put it in the chat. Hopefully we don't get too flooded with questions, but we'll do our best I can to get that through. So over to you, Mike.
Right on. And I want to thank first and foremost Rory for going right after June instead of me. You see this is your fault. I had to go find this tonight. And And how can you not be moved by that? And Kelly as well too, your stories, I know how true they are. I am by trade a forest ranger. I am by choice, and because I was elected in 2013, a vice president because of what I saw in long-term and designated supportive living places. I served as a strike captain several times in 2011, 2012, always in long-term care. And I saw the issues, and I saw the love that you and all the nurses, all the staff had for the residents there. And that's why I became a vice president. So I am here today because of what you do. Roy spoke to the fact that about we knew this was a problem, and what could have been done before. And AUPE, just a few months ago, we came up with a policy paper that mirrors this so much, that this Parkland time to care. It mirrors it. And why does it mirror it? Because it's all true. We represent an AUPE, about 18,000 members in nursing care and support services. And despite having that many people assigned, every site is a challenge. I remember going onto a site that was just getting organized. They'd done a strike vote, and they wanted to bring the union in, and they'd had a vote. They brought the union in, and I started talking to some of the members. They hadn't got their first contract, and I spoke to somebody who was a caretaker. He was the caretaker, and he was on call. And I says, well, when do you go off call? Never. Says he was on call 7 days a week. I talked to folks who didn't have casual illness, no sick leave. Can you imagine now with COVID, no sick leave? Even now the benefits are minimal and not adequate. We call people heroes, and then we expect them to take time off for free when they get sick because they're helping, they're doing things that no one else will do, putting their own lives. Not only that, they're putting the health of their families on the line too. So what can we do? It all starts in the union world with getting a collective agreement. And yes, they address like pay, benefits, sick leave, but we also strive our damnedest to get wording in to deal with short staffing, classification, rest breaks, actually having language to define a rest break, and to deal with scheduling issues as well too. You try and cover everything, knowing it's not enough. And oftentimes the language in a collective agreement, it's just presented as a recommendation to change the staffing levels. There's all kinds of workload assessments and so on. But too often you don't see changes. That never came to more of a realistic, the public could see this than the one site. When the one site became a major issue in Alberta and indeed Canada, it showed how our workers were being treated in healthcare. Because the companies, to maximize the profits at their facilities, they bring on people casually and part-time to minimize the amount of benefits. So then for generations, most of the workers are working in one place and another place to make a full paycheck. And sometimes you'd meet folks having to work three different jobs, 18 bucks an hour. And so that's why it became such a lightning bolt, the one site issue, because of the way the workers have been treated for a generation. And so these are the kinds of things the unions are trying to fix, to try and with the members. And I'm starting to go on a little bit too much now. I tend to do that because I have a real passion for this. But I remember I was at a a facility, and I'm not going to say where it is, but they were locked out. They were locked out for months. And the food that was being served by the scab labor was pretty cruddy, and it was Christmas time. The staff who were out, locked out, dug into their own pockets and bought every resident in that facility a Christmas dinner. They organized it themselves and they brought them gifts. They brought it to them. And that is the heart. That is the heart of long-term care. They are family. They are family. Thank you.
Thank you, Mike. And yeah, that's so important that AUP, QP, I know Heather Smith is on from United Nurses of Alberta this evening, Health Sciences Association, that the unions are there and making sure that workers have a voice. But it's a broader issue that we must all, as citizens, engage in and support. And so one of the things we hope at the Parkland Institute is that you will all share Rebekah's report, distribute it on social media, use it as best you can, but also put the pressure on the politicians, sending it to your MLA, sending it. We did send a copy to the Minister of Health and the Minister of Seniors today, so they can't say they haven't had it and haven't seen it. And just to recognize that there is a review that is going on, such as it is around long-term care. So our voices are very important to be heard now. And at the national level as well, there's talk about national care standards. So this is the time where we need folks to be speaking out on these issues. And so thanks to all of you for that. We have a few questions in the chat. I had said earlier we're going to put it in the Q&A section, but we don't actually have a Q&A section because we're not on a Zoom webinar format. But if you do have questions, I'll try to get to as many of them as we can if you're able to type them into the chat. I do have one question here from Laurie Sigurdsson, who I know is the MLA from Edmonton Riverview, as well as the NDP critic for seniors care and former minister of seniors. So great that you're able to join us, Laurie. And Laurie asks, and maybe Rebekah, you can start in on this. We have Bill 70 that has come into the legislature, and obviously the report was pretty much written by the time this came about. Can you talk about sort of the implications of Bill 70 and trying to protect legally these big corporations, Rebekah?
Well, thank you, Bill, and thank you very much to Laurie for that question, because this is literally happening right now. As we're trying to present the state of long-term care prior to the pandemic and during the pandemic. We have the voices of people like June and Kelly telling it like it is and saying what we need. And unfortunately, we have in the legislature legislation proposed that just does the exact opposite. And with Bill 70, essentially is very similar, I think, to legislation that was proposed in Ontario a few months ago as well, which essentially gives covers the liability of long-term care providers to prevent them from being sued by family members or by residents who experienced harm or lost a loved one during the COVID-19 pandemic. And essentially is like when someone gets you to sign a waiver and says, if you happen to die due to our negligence and a global pandemic, you've waived your right to sue us. And unfortunately, I mean, I'm being very glib here, but that's essentially what this legislation would do. And I think it's really important for Albertans to know where the motivation for that legislation is coming from, and that the for-profit and other private care providers have been lobbying directly to the ministers and to the government widely for legislation to cover their liability. And I think it's also worth pointing out previous Parkland research done by Dave Campanella, I think in 2013 and 2016, looked at who really owns the biggest stake in private long-term care and private continuing care facilities in Alberta. There were 13 companies in 2013 that he could find, but by far the largest stake was Extendicare and Rivera. And if those names are familiar to you, they should be. They've been very much at the heart of some of the worst outbreaks, some of the largest death tolls amongst residents across the country. And they've also, along with other large chains like Chartwell, made sure that they collected the CEWS subsidy, pandemic subsidy from the federal government so that they could continue to pay out shareholder dividends. So when you think about who's benefiting from this type of legislation, it absolutely is not grieving families. It absolutely is not residents who can't perhaps advocate very loudly for themselves and their own experiences during this time. And it's a big CYA for this government's policy choices during the pandemic and for their lobbyists on behalf of private long-term care.
Thanks, Rebekah. Just encouraging people to put their questions again into the chat if you can. That would be really great. I do see another question in there from Sandra Azakar. Sandra is the Executive Director of Friends of Medicare and a good friend. So Sandra is asking about the fact that when we started this report, Rebekah, of course, this was before COVID. And so a lot of the data is really prior to the pandemic. And so she's asking, what else can we be studying and researching during the pandemic? And I know you and I know that we are also working with somebody else on the call here for another report coming forward. But if you can talk a little bit more about other research that we hope to have out soon.
Well, thank you. And thanks, Sandra. I really felt that there was, as soon as I came back off of my parental leave on the 1st of April of last year and, took up the mantle of this report from my colleague. And I thought, how do we speak to any of this now? How? We're in the middle of this unprecedented, chaotic situation. And is any of this still relevant and valid? And so I really struggled with that for a few days, maybe a few weeks, to think how valuable it is, first of all, to have this before picture, like a literal snapshot of workers' experiences in long-term care right before the pandemic. We actually had a couple of responses that came in March of 2020 saying, like, I'm really rushing here. I can't really provide a long answer because, like, there's a pandemic going on. So we actually made the decision to close the study at that time because we felt we couldn't ask long-term care staff to devote their attention to some random survey, regardless of how important we felt it was. But at the moment, we're actually very, very lucky and very fortunate in that there are wonderful researchers doing exactly that and exploring the voices and experiences of long-term care workers during this pandemic. Some of that work is being done here in Alberta. I know Professor Naomi Lightman at University of Calgary it has been working on that extensively and also looking at the big element of precarity for workers in this sector, for a workforce that is largely made up of women and racialized women and immigrant women, and how their experiences are hugely important in that. Also, we've been collaborating a little bit on a research committee for CCPA BC and their partner in the Health Services Employees Union. I never get the acronym right there, but they're also looking at a multiple province study of how pandemic containment policies, to put it that way, COVID containment impacted on long-term care workers and on residents in different provinces. how did the BC experience in particular differ from what happened in Ontario, Quebec, and Alberta? So Parkland's been trying to share our knowledge back and forth with those researchers in other provinces to hear that as well. So yes, and as Bill teased, we are hoping that we will have a report to fill in that missing part of the story, the workers' experiences during the pandemic, hopefully before the summer.
Absolutely, and this is an issue, as have been said, happening across Canada, and so we are partnering with our national sister organization, the Canadian Centre for Policy Alternatives, on research and bringing that. So, but it is everyone here who has the ability to also tell your personal stories about how this is impacting on you and your families, and that has a powerful political implication as well. I did notice another question that came up from Tara Shipman in the chat. Tara has posted a little bit about working with disability care and those workers who are actually not in long-term care facilities, but are in people's homes, and very, very challenging work as well. And Tara is looking to the unions to say, you know, how can we get some better support for those workers that are also on the front line? And so Rory, I don't know if you want to jump in and talk about sort of the home care workers, the broader, because I know both AUP and QP represent both, but Rory, do you want to talk a bit about that more broadly?
Yeah, sure, Bill, and thank you, Tara, for that question. I guess first and foremost, you know, if there are folks who are not organized right now and you know don't have union representation, you know, in the healthcare sector, either our union or AUPE or other unions within the public would love to hear from you. Like QP, we will. It's pretty simple to get in touch with us. If you go to QP Alberta, you'll get phone numbers there, and just basically call one of our offices and say you want to get organized. And we have a full-time organizer here in Alberta. We will talk to anybody. Now, also understanding that you know that there's different levels of precarity. You know, it's right across the healthcare system, especially in long-term care and continuing care. We understand that, and you know, Mike talked about that, and we have that situation. I'm sure Kelly and June can talk about it. You know, people putting together 3, sometimes 4 different shifts during a day or during a week. And this is, you know, we talked about single sites. So one of the things we're always looking to, you know, organize the unorganized, but we also understand that, you know, precarity, whether it's continuing care, long-term care, or other parts of the healthcare system is just rampant. So yeah, we want to hear from folks. You know, and, you know, one of the things that, you know, Jean and Kelly talked about is, you know, they both talked so eloquently tonight, but one of the things was, you know, they can't really talk about where they work specifically, right? Because, you know, some employers are, you know, okay, and some employers are, you know, really, really punitive and can really strike back at workers. So we understand that as well. But, you know, our union, other unions within Alberta, we want to hear from workers, and we will do our darndest, absolutely, to, you know, to find you representation, you know, and make sure that, you know, we have those, you know, you have that ability to get a collective agreement, to get some protection in the workplace. And in the meantime, you know, if stories need to be told, you know, we have access to the media. You know, we're here tonight, but we can also, you know, press conferences, media releases, social media, we can get that word out. We can protect you as well. So you know, and if Mike's got any to add, you know, I'm sure he can talk to that. But I just know that in the labor movement, you know, it's our whole reason for being is to make sure that working people have, you know, have representation, have protection, and have some way of getting a better life. And, you know, we will help you do that. So please reach out to us, and, you know, we'll do whatever we can to improve that situation.
Thanks, Rory. We have another question from Anahi Johnson, and maybe this one could be for you, Mike, if you know the answer around it. It's with respect to contracting out in long-term care facilities, and that change needs to be approved by Alberta Health. So she's wondering if you know how that process takes place and what that approval process is. So Mike, is that something that you can jump in on?
When you say contracting out, is this like a unionized site that's decided to contract out some of the work? The care?
It might go for either, so probably, yeah.
Yeah, when in doubt, the best thing to do if you're organized is to get a hold of in AUP, it's a member servicing officer. And member servicing officer knows the collective agreement like it is the Bible for specific sites, and would be able to determine whether or not the employer was within their rights to do that. And if it looks like something dodgy is going on, then we can certainly bring that forward. If it's something that needs to be addressed, then we have an organizing department that can work closely with the sites to help try and prohibit that, whatever means by if you're in contract negotiations. There has been a couple of cases recently in the last year or so of a long-term care site firing all the staff and contracting out to a company in British Columbia and then offer people $6 an hour less. And they were able to get around it legally because they were from out of Alberta. So these companies are always trying to find some way to take advantage of folks and take advantage of whatever government regulations that are there that would be permissible to that. But bottom line is, if something smells bad, then it usually is. Contact an AUPE. It's you're a member servicing officer. You're not sure who that is. You can call the 1-800 line, or as a vice president, m.dempsey@aupe.org. Send me a line. Say what the problem is, and I'll get you the help that you need.
Thanks, Mike. I see a comment here from Bruce, and maybe I'll ask Kelly or June to sort of just respond to this. It's not so much a question, but I think something you can agree with. Bruce, who I know has worked himself in long-term care, says we'll only change when Alberta gets rid of the private for-profit corporations, and when Albertans vote for change in provincial government, Albertans have the power to make change. So thank you for that comment, Bruce. Kelly, do you have any thoughts in your experiences? Because I know you've worked in various centers over the years in terms of what that would actually mean.
Yeah, I have, and I have to agree, like, we do need a change in the government. It definitely starts from there. Where I work, I do say I go to work because the management is good, and it trickles down. And it's the same, in the world, like, with this whole situation, it would start at the government level and it will trickle down, so we really do need that support. We need that either that change or that support, whatever it may be, to kind of start at the top and work its way through. I have to agree, like, it's been going on way too long. So it is time for change. June?
June, do you want to jump in on that?
I do.
Question?
Yes, I do agree with what Kelly says. We need to focus more on people instead of private and profits. And if we get rid of all these private for profit and profit people and focus more on people, I think it would make a big difference. And yes, the government needs to step in, like I said before, and do something about all this. And yes, I kudos to Kelly, whatever she said.
Great. I'm just looking through to see if I'm missing any questions here. Certainly lots of very powerful comments in the chat if people are following along there. We have a question. Where do you think the current review of continuing care the government is doing is going to go? And I think that's a very good question for all of us to perhaps reflect on as in terms of wrapping this up. So maybe let's start with you, Rory, if you could talk about sort of where do you think this review is going to go in a minute, and then we can each have one last kind of comment about next steps and what needs to be done coming out of all of this. So Rory?
Where I think the review is going to go is that they're going to tell a bunch of lies and say that, well, things are, they could certainly be better. But what we need to do in Alberta is get creative, and that'll mean more privatization. And I'm sorry to be, it probably sounds cynical on this, but I believe that's where the government is going to go. And the earlier question about, doesn't Alberta Health have to sign off on changes when they contract out? Yeah, they do. But this government would sign off on anything, from a private contractor. And we know right now, and Kelly and I have talked about this, that there's right at this very moment, there's people being hired, and they're called so-called comfort care aides, and they have very minimal qualifications, zero training. And Kelly said to me, we know it's dangerous, but we need some help, so we need these people in there. And what the government is doing is using hiring agencies to grab people up at very low wages, zero training, throw them in there. And these are tasks that were done by family members, prior to quarantine and things like that. So it just shows that, this government knew what was going on when they came in. They had no intention of changing it. When the pandemic hit, again, we could have talked about, proper wages for people, proper training, funding the system properly to make it safer. They couldn't have given a damn. And now we see this situation. So when you ask me what they're going to do with this review, I suspect that they're going to pat themselves on the back, say that the market can improve things, and bring in more privatization. So I hope I'm wrong on that, but I don't believe I am. So again, it becomes that much more important for us to make our voices heard, and to let, as Bruce, quite eloquently put, until we have a public system, until we recognize that long-term care, continuing care, and other forms of care for the elderly, infirm, and the vulnerable should be part of the public health care system, we're not going to get anywhere. So I would say that we should use, when they produce this report, that we use as a rallying cry to get proper, a proper look at what's going on in the system, proper funding, and a real change to take care of the people who need it the most.
Thanks, Rory. Very powerful words. Mike, last words on sort of next steps and where we go with this report and with this opportunity, such as it is, as Rory points out, with the government to actually have a real conversation about improving long-term care. Mike?
Well, I'm very similar to Rory on this. If whatever comes out as anything about more for privates, it's the wrong way to go. Private always means minimum standards. And why are we providing the minimum standards to people who have given the maximum in their lives? We owe it to them. It's the money will, for the most part, in the private that the government provides the privates, it will leave the province, it will leave the middle class and go to that 1% at the top. That is where it will go. It will not go back into care. And any conversation that tries to make it sound like it could is wrong. So kind of blunt there, but Roy said it quite well, so I'll leave my words at that.
Thanks, Mike. Kelly, any last words on sort of where we go from here and how we get the voices of frontline care workers really amplified out there at this time?
I think that we just have to continue being that voice for our seniors, our residents, our vulnerable sector. At the beginning of the pandemic, I had to go off due to, I have severe asthma. People weren't sure how that was with COVID. So when I came back after being gone for 7 weeks on a dementia unit, I was concerned. I thought, oh, my residents might not remember me, and now I'm wearing a mask and a shield. I look like I'm from the space station, who am I? But they did remember me. And I had one of them say to me, I'm so glad that you're home, because when you were gone, I just kept saying, if Kelly was here, everything would be better. And those are the kind of reasons why we have to speak up, why we have to be their voice, because they can't do it for themselves, or why we keep going back every day. So hopefully these types of reports can just keep going out there and letting the world know, what the reality is. in long-term care, because I think people, they just don't have any idea. You know, I know when my grandfather got sick and needed care, if it wasn't for my training, he would have been put in long-term care way before he needed, you know, and I was able to be his voice because of what I know. But not a lot of people know that because they don't work in the industry. So, you know, I just think it's very important that these studies continue for this reason. Thank you.
Thank you, Kelly. Very powerful. June, do you have any sort of last words on next steps, where we go, how we get the voices out there?
Where I think it should go, not where it's going to go, where I think it should go is to fix it, change it, the broken system, to fix the broken system. And how did we get here? We need to, in order to fix something, we have to figure out how we got here. We're doing what we're supposed to do right now. Rebekah, all of us, Kelly, we're making our voices heard, and we need to continue on this path. Like I said before, our reason for being in long-term care, working with the elderly, because we care. Where it's going to go, I don't know. Because when we're in a crisis, we all yell, we jump up, we fix things, we see everything that's wrong. When it's over, oh, everything is good, or we forgot. It's unfortunate, and I hope I'm wrong, but long-term care is broken. It is broken. It is totally broken. Need to go right back to the foundation, rebuild it, and make it what it should be, not what it is. So I'm hoping that this report will change. And when I reach to that long-term care, if I do one day, which I don't plan on it, but at least I can see other people are enjoying it. And there'll be a June there, there'll be a Kelly there. And they'll recognize Kelly when she walked through the door. Thank you very much for having me.
Thank you so much, June. That's again very powerful, and for all that you do. Rebekah, last words on where we go from here, and to respond to the question about making sure the voices are heard in this review and beyond that.
All right, this is like the third time today I'm crying. I don't know if what I can say is in any way more important than what Kelly and June have just so powerfully said there. But I think, you know, unfortunately, it does also, at the moment, it all comes down to politics and to political will. And I think when you have a government that is focused on corporatizing healthcare, they're focused on corporatizing parks. They seem to feel that corporations have more value than Albertans. And that's, if there's any thread I can pull through from, you know, this last couple of years with this government, that's what I see in the legislation that they have put forward. I think the current review is just an extension of that. So many people who tried to make their voice heard through that process felt that the questions were very leading and manipulative, that it was framed in such a way that there was already a preferred outcome. And as Rory and Mike have also pointed out, that outcome almost inevitably seems to be leaning towards more privatization, more contracting out of the so-called non-essential services like food services and housekeeping, which what we know from this pandemic experience are vital to keeping residents and keeping staff healthy and improving their quality of life. So having quality jobs for those roles where there's paid sick leave, where there's, you know, full-time positions, and those workers don't have to try to work in 2 or 3 facilities like the vast majority of our survey respondents, I think is really key. And unfortunately, it sounds like this government has already decided to go in the opposite direction because, as has been pointed out, across this country, and the tragedy that we're seeing in Ontario is based on the fact that long-term care is being used as an investment prospect for real estate rather than human value, and for pension funds for people who haven't yet retired and needed elderly care. And so I think that's the place that we have to start in the long term. But unfortunately, we have governments here in Alberta and across Canada that are very antithetical to that. And I don't know if even the national federal standards being proposed by the Liberal government in Ottawa will go that far. So we have to be loud and we have to be angry and we have to be heard. So thank you.
Thank you, Rebekah. Again, in closing, as you've heard, I think it's so important that we amplify the voice of these workers. This study is just one aspect of doing that. You all have networks of people, coworkers, friends, your social media networks. We hope you can share the study, but also continue to make your own voices heard. We had a press conference earlier today. A number of media outlets showed up. We're hoping that we'll get some good coverage, but there's an opportunity then for you to write letters to the editor of your newspapers to get that out there. And yes, as challenging as it is, we do need to keep the pressure on the Minister of Health, the Minister of Seniors, and your own MLAs. So do not let them off the hook, even if you're feeling cynical towards them. It is their duty to respond to you, and it could be as short as, I've read this report, I want your answers on it, I want to know that you've read it, I want to hear it back from you, and they have a responsibility to get back to you as you go forward. Also, there's other great organizations that Parkland Institute works closely with. Public Interest Alberta has a seniors task force with many fantastic seniors organizations around the table, so getting seniors organizations out there. And of course, Friends of Medicare has been leading the charge on the issues of privatization of healthcare and seniors care for many, many years. So other opportunities to join and support them. I want to close by thanking, of course, Rebekah, who's done an amazing job on this report and tonight's presentation. If we were all in one room, we would have a round of applause. You can pick the opportunity to clap in the reaction section here. June and Kelly, thank you again for your work, for your voices, for your passion. It's so wonderful that you were able to join us tonight. And Rory from CUPE and Mike from AUP, again, that leadership within the union movement and the support for us and for this report's been really great. So in closing, if you want to get connected with Parkland Institute, you can sign up. We put out weekly, roughly, emails. We don't inundate you. Sarah's going to put in the chat the link so you can connect on that and just make sure you're signed up for our emails. And just to put it in there that Parkland, of course, relies on the support of our donors. That's how we survive for all of our research and program events. So if you're able to consider financially supporting the work of the Institute, you can also go to the donate page. I think Sarah's going to put that in there as well. And all donations are given a tax receipt. Thanks for being part, because we're part of the Faculty of Arts at the University of Alberta. So thank you all again. We look forward to seeing you at future events, perhaps in person at our November conference. We're hoping that that will be in person. And I hope you enjoy the rest of your evening. Thank you.